Good morning, committee members. The clerk has confirmed that the meeting we have a quorum and we are ready to begin. I call this meeting to order. Welcome to meeting number 13 of the House of Commons Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. Today's meeting, again, is taking place in the hybrid format pursuant to the House Order of November 25th, 2021. Members attending in person in the room and remote using the Zoom application. The proceedings will be available via the House of Commons website, so you are aware the webcast will always show the person speaking rather than the entirety of the committee. Given the ongoing pandemic situation and in light of the recommendations from health authorities, I would expect all members attending to follow the appropriate health protocols that are in place for the pandemic. To ensure an orderly meeting, I would like to outline a few rules to follow. Members and witnesses may speak in the official language of their choice. Interpretation services are available. You have the choice at the bottom of your screen if you are attending virtually or using the earpiece here in the committee room. I would ask any member to get my attention if there's a disruption in the interpretation translation services. Before speaking, please wait until I recognize you by name. If you're on the video conference, please click the microphone icon to unmute yourself. Those in the room, your microphone will be controlled as normal by the proceedings and verification officer. When speaking, please speak slowly and clearly. When you are not speaking, your mic should be on mute. A reminder that all comments should be addressed through the chair. With regard to a speaking list, the committee clerk and I will do the best we can to maintain consolidated order of speaking for all members, whether they are participating virtually or in person. This morning we have, as we continue with our labor shortages, working conditions, and the share economy, we have 3 witnesses that will be appearing. We have 1 witness that we're still dealing with a technical issue with, and we're unsure at this time. So from the, I would like to welcome our witness, Canadian Federation of Nurses Unions, Linda Silas, President, Federation of Workers of Quebec, Denis Bolduc, Secretary General, and Service Employees International Union Healthcare, Charlene Stewart, President. I would ask each of the witnesses, there is a 5-minute timeline on your opening comments, and for the benefit of the committee members to maximize their time, I will be enforcing the 5-minute rule. So at 5 minutes, I will ask you to stop and proceed to committee members' questioning. So beginning with 5 minutes, I will now turn to Madame Silas, President of the Canadian Federation of Nurses Unions, for your opening 5-minute statement. Madame Silas, you have the floor.
Thank you, Mr. Chair and committee members. Thank you for the invitation to appear before this committee on behalf of Canada's nurses. As mentioned, my name is Linda Silas. I'm president of the Canadian Federation of Nurses Union, and I'm a registered nurse by profession. The CFNU is Canada's largest nursing organization representing frontline nurses, the RNs, the LPNs, the RPNs, which are psychiatric nurses, the nurse practitioners, and nursing students. When you say frontline, that's us. Just last week, I met with nurses in Manitoba to hear their stories and listen to their solution on how to stop nurses from leaving our system. First, they said, show us respect at all levels of nursing. We need standardized education, remove obstacles placed in front of internationally educated nurses, stop the proliferation of agency nurses. It's killing us who commit to employers in our province, increase and fund nursing education seats, increase support staff. I can't do it by myself. Lastly, one said to me, I've had enough of mandatory overtime. I know there's not enough staff, but overtime won't fix it. If they don't fix our unit, we will be closing. And where will my cancer patient go then? Nurses take their jobs very seriously. They care deeply about the well-being of their patient and have a duty to uphold professional standards in their work. Over 80% of nurses report insufficient staffing in their workplace. Two-thirds are saying the quality of care has declined over the past year. And severe burnout, it's up to 45% from 29% just pre-pandemic. These factors are pushing many nurses to leave their job and the profession itself. Since the beginning of the pandemic, the numbers of vacancies in healthcare and social assistance sectors has grown significantly, reaching over 118,000 as of the third quarter of 2021. Almost 34,000 of these job postings were from nurses, and many of these job postings went unfilled for more than 90 days. How do we prevent more nurses from leaving their job and attract enough nurses to address these ever-growing vacancy? We need a pan-Canadian health human resource plan that will equip the provinces and territories with the tools and resources they need to retain and recruit enough nurses and other healthcare workers to sustain and cherish our public health system. From hiring from hiring guarantees to new graduates, just like they did in Nova Scotia, to facilitate the transition from part-time to full-time position, to provide opportunities to upgrade skill, bridging programs, or like New Brunswick, the Earn As You Learn program. Let's recognize those experienced nurses as mentors and provide accessible mental programs for everyone. For the sakes of both our workforce and our patients, we simply cannot afford to lose any more of these critical frontline workers. This multifaceted approach would allow the federal government to provide target funding to the province and territories so they can respond to the need at the local level. The CFNU is well placed to work with the federal, provincial, and territorial government around retention recruitment initiative. We have a track record that goes back 2 decades when faced with similar nursing shortage. We contributed to the final report of the Canadian Nursing Advisory Committee in 2002, the nursing sector studies that followed, and produced integral strategies for nursing resource in Canada. Or again, AWPI, the Aboriginal Workforce Participation Initiative, all federal government programs. Following this, Health Canada approved a proposal to CFNU to implement 10 pilot projects in the provinces as well as Nunavut to improve nurse retention and recruitment. One lesson we learned is that successful endeavor happens when the federal government works with unions, employers, governments, university, colleges, professional association. We can accomplish a lot together. Just in 2019, we spent over $175 billion on health workforce. That's nearly 8% of the country's GDP. And in spite of all this, we know very little about these workers. Among 60 organizations in healthcare, CFNU signed on the call of action to urging the federal government to establish a national health workforce body to collect data, strategize, and fund strategies. Province and territories cannot manage the scale and complexity of this crisis on their own. It's long time past the federal government steps in. Once again, I thank you for providing me this opportunity to contribute to this important study and congratulate yourself for doing this important work for Canadians. I'd be happy to answer your questions. Merci.
Thank you, Madame Salas. Monsieur Bolduc.
Mr. Bolduc, you have 5 minutes. Thank you. Chair, good morning, ladies and gentlemen, committee members. First of all, I wish to thank you on behalf of the FTQ, Fédération des Travailleurs et Travailleuses du Québec, to give me an opportunity to speak on the important issues raised by the study currently underway before the committee. We represent some 600,000 members in Quebec in the public and private sectors and thousands of workers in the health sector, social affairs, and education. And the pandemic of the interpreter is sorry, but the sound cut out, unfortunately. And the virus has spread rapidly, which caught our institutions off guard in the first few days and weeks of the pandemic because nobody had foreseen the scale of the health emergency that was caused by it, nor its impact on the economy, culture, and social life. Once again, the interpreter regrets this brief technical interruption for some of our institutions. And it also has to do with the important work by thousands of men and women in frontline healthcare services and care to individuals, personal care. Often thousands of jobs are precarious, not recognized, and not valued, and people think they can get by without them. And this crisis has brought out systemic inequities that exist all too often for these essential frontline jobs. And those professions are mainly occupied by women or immigrants who are either underqualified or whose qualifications are not properly recognized, or they have a precarious job situation. So I'm pleased today that the committee is taking time to shed light on the difficult period we've come through. There are undoubtedly important lessons to be drawn, and the federal government no doubt has an important role to play in this. Therefore, I would like to draw your attention to a few aspects to be considered. We recognize, our union recognizes, that a number of employers have had problems with recruitment in recent years that may vary from region to region, or from sector to sector, or from province to province. And also there is a scarcity of good jobs. And with the interplay of supply and demand, considerable disequilibrium can exist in certain occupations, professions where conditions are not sufficient to attract and retain competent workers that are loyal. And more specifically regarding the shortage of labor and in the care economy, I'd like to explain a few important issues that were raised by our members who work on a day-to-day basis in that sector of activity. First of all, compensation is not always competitive compared to other occupations that sometimes require an equal level of skill, and in a number of areas, the disposable income of workers, especially the most precarious jobs, is decreasing because of the ongoing pressure of the cost of private drug insurance, which contributes to impoverishing them year after year. The shortage of labor, which causes pressure on the teams already in place who are already under pressure because of overtime that is often mandatory and schedules that are being broken or rearranged, refusals of time off, which has been noted in a number of workplaces during the pandemic, even sometimes in the case of people who were already infected. And there was also the phenomenon that workers are called upon to work in several different institutions that are sometimes separated by considerable distances. So in actual fact, the working conditions do not foster the attraction and retention of workers in the care environments, and we have to deal with this issue. I'm not the first person to tell you this. In a number of work areas, workers in the front line are leaving after only a few years. And we cannot ignore the wage gaps for very long that exist between men and women and between comparable jobs in different sectors, especially in the inflationary context that is now occurring. The federal government must provide more support to the provinces and territories and must increase health transfers and also for labor training. And once again, the interpreter regrets a brief technical interruption. Thank you for having invited me to speak, and I'll be happy to answer your questions. Thank you, Mr. Balduc.
Is still unable to virtually connect with the committee. We will see as the time goes on. So what we will now begin is the questioning. Yeah, is the first round of questioning. So we'll begin from the Conservative side with Mr. Leipert. Sorry to catch you. If you got a moment, we will begin with the first round of questioning as soon as you're ready, Mr. Leipert. The floor is yours.
Thank you. Thanks for the presentation this morning, and I think that I can speak for pretty much everyone around the table and across the country. The importance that the nursing profession has displayed over the past couple of years has very much gone above and beyond in many cases as to what would normally be expected. And I think that doing this study on the heels of the pandemic is a little. I'm a little concerned that that it's going to be skewered by what we've been through as a globe over the past 2 years. But what I think it also showed to me, and just for background purposes, I spent 2 years as health minister in the province of Alberta. So I had some opportunities to deal with the system. It seems to me that that we have some major structural issues with healthcare in the country. Number one, we spend all of our time, or almost all of our time, treating the ill and the sickness side of healthcare, and don't spend nearly enough time on the preventative side. I'd like to know from both of the two union leaders who have spoken here today whether you as organizations are working with provincial governments, primarily because they are the ones that deliver health care, to look at fixing structural issues in health care, because I don't believe that simply throwing more money at a situation that is structurally in need of repair is the right answer. So I guess I'm more interested in what are your two organizations doing at the provincial and also at the federal level in trying to see if some of these issues can be sort of worked back to say, we have a structural issue here, we need to deal with it before we can fix the problem that your members are dealing with on a daily basis. I'd just like a couple of comments on that.
I'm not sure. I'll start, Mr. Leipert, and I have to say you must be a happy man that you weren't Minister of Health during the pandemic. I'll start with your comments around the study might be skewed because we're still in a pandemic. That is a reality. But if the committee reads any of the submission of CFNU prior to the pandemic, we were in a health human resource shortage then. Today, we're in a crisis. I've never seen over my 20 years nationally or 18 years nationally, 25% of nurses saying they are leaving healthcare completely. 50% are saying they want to change jobs. So that I've never seen. When you say a structural problem, one thing we have to admit, we have a little bit too many queens and kings out there that try to manage their own healthcare system when we have a country governed under the Canada Health Act, and we need to work together. We're way too small of a country to have so many different strategies, so many programs. You, when you were part of the provincial government, but also the federal government, I'm sure you were with the building trades and the building sector, big in Alberta. They have an agency to look how many construction workers do we need in this country. And that has existed for many years. We have nothing like that for close to 1 million workers that work in healthcare in Canada. And that's when we say the federal government needs to have the proper data, proper strategy, and proper funding for one of the largest human resource in this country. And that's where we're talking about the agency, a body, we can call it what we want. I totally agree with you. We need to switch gear, talk about prevention. My first report to the federal government and provincial government way back then was in New Brunswick, was early 1990s, talking about community health centers. We need to make sure that we provide prevention, home care, and make sure that we have the mental health, of course, but make sure we have the good acute care sector when we need it. And that's truly important. I think all unions are willing to work with you on this and with all provincial and territorial government.
Takes up your time. What I'm going to advise the committee, Ms. Stewart is now available, so rather than continue, because some of the panel or committee members may want to question her, we'll now go. We'll need a short sound test with Ms. Stewart, but she is available. There she is.
Great. Good morning, everybody. And I apologize, 2 years in.
Yep. Okay. Ms. Stewart, we're going to do a brief sound check. We're going to suspend for 2 minutes and do a quick sound check, and then you'll proceed with your opening statements, and then we'll resume with questioning.
Great, thank you.
Okay. If we could get your attention at this time, I'm going to ask Ms. Stewart to give her opening statements. Madame Stewart, you have the floor for 5 minutes, please.
Great, thank you so much. Members of the committee, my name is Charlene Stewart. Thank you for hearing from me today. The Service Employees International Union, SEIU, represents 2 million members across the United States, Puerto Rico, and Canada. I proudly serve as International Vice President of our union, as well as President of SEIU Healthcare, which represents over 60,000 frontline healthcare workers in the province of Ontario. As I stated to your colleagues at the Standing Committee on the Government Operations and Estimates last year, our elder care system, more broadly, has failed. It has failed working women who make up the vast majority of frontline staff. It has failed seniors who were robbed of dignity and life. It has failed their families who rely on the care economy for that which we cannot do ourselves. Again, the care economy is failing Canadians. We should examine the reality and the solutions through the lens of people, not partisanship. Conservatives who hold dear the idea of the family unit ought to be outraged at how our sisters and moms and their children are robbed of economic stability and social cohesion. the Bloc Québécois platform presented itself as resolutely feminist, and rightfully so, as what we're talking about for the most part is a population of mostly elderly women who reside in nursing homes, a care economy labor market, that vast majority which are women, and childcare, which again often falls on the shoulders of women. It was the NDP, as I understand it, specifically MP Benita Zarrillo, who challenged this committee to examine the care economy. I want to thank MP Michael Coteau for informing me of MP's Zarrillo's work to have this committee examine what the Canadian government and its parliamentarians can do to support women in the care economy. And Liberals, under the leadership of Prime Minister Trudeau, who in the most recent federal election echoed the words of distinguished research professor of sociology, when conditions of work become the conditions of care. And that, the conditions of work in the care economy, is what I wish to focus on today. I wish to paint a picture for you of the journey of so many care workers, starting with immigration. Canada has a robust immigration system on which we rely for so many things, including economic growth. The truth, however, is that too often it is the start of an exploitative system. As a country, we devalue women's work, and we see that in the wages and working conditions of women in the care economy. After opening our country's borders to care workers, we do the opposite of forget them. What we enable is a system of poverty wages that denies them job security and basic benefits. These working women include personal support workers, domestic workers, and childcare workers. Those in the healthcare system, like PSWs, are the women I'm proud to fight for in our union. Unfortunately, in the past, public policy is often distilled down to campaign-style tax credits. Let me be clear, boutique tax credits are not the solution to end systemic exploitation. Those are consumer side savings that do nothing to confront the conditions of work. We need provider side solutions that enable the women who care for our families the economic means to also provide for themselves and their own families. We need to support their efforts to unionize, because within a union, they can speak up collectively without fear of being fired or worse, threats of deportation. Let me remind you of one such example of care economy exploitation in our nation's capital. There at PS, during the day, herself living in a homeless shelter at night. These anecdotes are everywhere. We don't need more data, we need action. After the pandemic brought into focus the everyday experience of care workers, as well as our reliance on them as a societal safety net, I'm urging this committee to bring actions to words, to reform the conditions of work and care economy workers in your communities. As far as solutions go, I want to acknowledge those honorable parliamentarians who voted to support the financial resources to fund a new framework to deliver childcare in Canada. Foundational to the National Childcare Framework are good-paying jobs that put people before profits. We should extend that childcare framework into healthcare, a system in the midst of a worsening health human resources crisis. It's on that basis that I look forward to working with you all to support the women who care for all of us. Thank you.
Ms. Stewart, you concluded below your timeline. Thank you. We will now resume questioning, and I will go to Mr. Coteau for 6 minutes.
Well, thank you very much. I want to thank all of the witnesses today. Thank you so much for sharing your stories and representing your members so well. There's no question that during the pandemic, there was a lot revealed about our healthcare system in Canada. I remember, Ms. Stewart, reading that story that you mentioned. It was in the Ottawa Citizen, I remember, and there was a personal support worker. In fact, there was many. I think there's a couple dozen. It was like 25 personal support workers that were in the shelter system in the evenings and at night, and then going out to work in the day. So there's really, without a question, a huge problem in the system today. I was hoping that you can talk to us a little bit about just the minimum wage today, like the cost of living, the minimum wage, and what is a suitable rate for mostly women, as you were saying, and minority women living in urban centers, taking care of our most vulnerable. What is a livable salary when it's broken down to a minimum wage?
Thank you very much for the question. Yes, devastating, and it was not uncommon to hear of women in shelters or, finding other places, living with other family members. Minimum wage in home care right now is $16.50 an hour. That's barely over the minimum wage in the province of Ontario. Of course, we all know the economic crisis that's existing. Price of gas, home care workers depending on their vehicles. A minimum wage, at the very minimum, should be closer to about $27 an hour. And that would be a start of a living wage. Again, the home care personal support workers have got to use that income to travel from client to client. The price of gas, they're basically using their own wages to pay for gas to do that. They don't get the travel time as well. So right now we're seeing a minimum wage of $16.50, which is barely over the provincial minimum wage. When you take a look at the system as well, what we desperately need across the provinces is universal wages. Minimum wage for PSWs is $16.50. It varies in long-term care and hospitals, which just creates a competitive market for healthcare workers, which causes obviously shortages in places like home care where the wages are so devastating. And your point about a lot of immigrant women, also it's shown that caregivers, a good majority of them are Black women. Again, studies showed in 2021 that majority of those are women of color and Black women who have got, a lot of them are migrants to our country as well.
You also mentioned about, just the cost of travel between, I know that the price of gas, it's obviously increased. And when I spoke to a couple of personal support workers a few weeks ago, they talked about the disalignment between, the time spent traveling in between jobs and also the cost of traveling today. And it actually pulls their salary a bit down from the $16.50 minimum wage. Can you shed some light on that? Is that an issue?
Absolutely. And, some of these women, especially in the last week, have called by the dozens saying that they can't do it anymore. And what's sad about that is that the home care services that they provide, what wants at home. It's a financially responsible way to deliver services in the province. And yes, they end up paying to go to work, is what they've said to me. At $16.50 an hour, when you're only getting paid for the time that you're in the client's home and not for the travel between client to client, and the gas being almost $2 a liter, they were paying for their own gas, and it was not, it didn't seem reasonable or actually sustainable for them to be providing such service. It cost them money. They were losing money by going to work. And as I said, dozens have quit home care, which we should be concerned about. And when it comes to groceries, I've talked to caregivers who talk about how they provided food for their children and ate one meal a day because they couldn't afford to buy groceries for the entire family.
Wow, it's unbelievable, the stories you hear out there. I'd like to ask President Silas, did I say your name correctly? I apologize if I didn't, but you brought up two facts it was just 25% of nurses have left the profession and 50% are thinking about leaving. Can you talk about that a little bit more?
Oh, you can say me Linda, Michael, don't worry. 1 in 2 nurses are saying, and when I say nurses, the whole categories of nurses are saying they're considered leaving. So that's the over 50% in the next year. And that's why we have such a little window to convince them to stay within the healthcare field. We see 19% of nurses saying they've had enough, they're completely leaving. And that's either true retirement, but that number is quite low, around 7%, or just leaving and finding other jobs, such as real estate. So we really, similar to what Charlene was saying, we have to fix the workplace. We have to fix the working condition so we will retain those educated healthcare workers.
Thank you so much. Thanks, Chair.
Madame Chabot, à vous la parole.
Madame Chabot, you have the floor for 6 minutes. Thank you, Chair. Hello to all the witnesses. Thank you for your presentations, and particularly Linda and Denis, with whom in another life I had an opportunity to stand together as activists. So we're doing a study on the labor market, among other things, in the care economy, and I appreciate the picture that was drawn for us. However, unfortunately, I must say, it is a picture that we're not unaware of, because there have already been issues with regard to the scarcity of labor and attracting and retaining workers, and issues of labor organization and working conditions, which have worsened due to the pandemic. But it is troubling to see to what extent such a major area in our economy, and from a social viewpoint, which constitutes our healthcare, to what extent it can be placed in difficulty due to the conditions of exercise that ought not to exist. But as you know, in this study, this will enable us, of course, to get some direction. But the beauty of our Canadian legislation and the provincial legislation in the healthcare sector is to protect universality and free healthcare services of all that. And each province is called upon. It's up to each province that has the jurisdiction with regard to the organization of the system and the organizing of healthcare and the organizing of services, and our major unions that work very hard, which I acknowledge in each of the provinces, have been able to defend quality health services and defend working conditions in order to improve the plight of their members. And in Quebec, we have pay equity legislation that's been in place for 25 years. There are certain tools, and I acknowledge all the interventions you've done. And my question is the following, Denis Bolduc, Mr. Bolduc, sorry, sir, as we'll say in the committee. There are some troubling things in our health sector. For a number of years now, while needs are increasing in each province, federal budgets are shrinking. Today, the federal government is contributing 22% of healthcare expenses, whereas in each province, just to maintain, we're talking about a 5 or 6% increase. It's the biggest budget for each province, and unfortunately, the government is not doing its fair share. So don't you believe that Quebec's demands and that of the provinces for healthcare transfers of 35% would be the right way to make a real change of direction in our health sector and to support our healthcare workers? Thank you, Ms. Chabot, for the question. So, unfortunately, a clear answer to that, a clear answer to that question would be yes. That's what the FTQ is saying, that federal transfers for healthcare to the provinces should be substantially upgraded and should go from 22 to 35%. As you know, there are two priorities: health and education. And the health sector has been subject to budget cutbacks over the years, and each time austerity measures are applied in the health sector, we weaken the system. We are weakening the system year after year, and until we rectify the situation, if we want to retain the staff in the hospitals and in service centers and in home care services, we need to provide them with working conditions that will make them want to stay in the system. If the work conditions are not attractive enough, then people leave. As we have seen in recent years, there have been people who have come into the system all enthusiastic, but they quickly become disillusioned with mandatory overtime and harsh working conditions, not enough support, and so they leave the sector quite simply. They leave their jobs after 2 years, 3 years, or 5 years. We often see this. Thank you. And my second question concerns labor training. I don't know what model exists in the other provinces. I know in Quebec it's quite unique. There's a commission of the labor market partners that includes employers and the major unions, as well as the government departments concerned. And we know to what extent, and in fact we've seen this in the pandemic, to what extent supporting workers also involves training. Is there something, a key role that the federal government could do in driving up these training budgets, and are there targets for training, Mr. Bolduc? Yes, indeed. Is my microphone on? I don't see it at the bottom. Okay, yes, the mic is on. My apologies. Yes, as a matter of fact, this is one of the solutions to upgrade training budgets, federal training budgets for labor, for worker training. As you stated, we have a similar system in Quebec where we can work on the training of the workforce in order to respond to the issue of the labor shortage. I can give you an example. There are a lot of employers who turn to the digital transformation, and there is the digital shift, and often I draw a parallel with the interpreter. Sorry, there was a brief interruption. This transforms the work environment, which will become obligatory quite soon in order for us to take into account climate change, and work environments will be transformed, and we have to evaluate how jobs are going to be transformed because we have to take action. And currently there are jobs that exist that will disappear and other jobs that have not yet been created, but they will be created and that will appear 2 or 5 years down the road. But there is currently a certain mass of jobs that are going to be transformed on account of these changes in order to face climate change, and this will result in a situation where workers will have to be assisted in that transformation process, and it involves, sir? So yes, it's important to upgrade the federal transfers for labor training. Thank you.
Zerillo for 6 minutes. Madame Zerillo, you have the floor.
Thank you, Mr. Chair, and thank you to the speakers that came to speak today. And I appreciate the witnesses shining a light on care work being gendered. Traditional women's work has been undervalued for too long and now moving into exploitation. And that's no accident based on long-standing gender discrimination, and even worse for intersectional women, immigrant women, and women of color. With care work making up 8% of the GDP, and with an aging population, the care economy has the potential to grow exponentially. And definitely we know that we need the workforce behind it. So my questions for the witnesses just is around privatization. There's been some move to privatization in this area, and I would just like to hear from each of the witnesses on how privatization has impacted the quality of care, but also the working conditions for the workforce in the care economy.
Have you directed the question, Mr. Zerillo, to?
Madame Salas first, and then perhaps Mr. Bolduc, and then if we have time, Ms. Stewart.
Thank you, Deputy Zerillo. For us right now, it's the crisis in our long-term care and home care sector. The lack of transparency of where public dollars are going to these private agencies. Ms. Stewart will be able to talk about their research done in the private sector and home care and long-term care. But for nurses, it's the agencies. We're seeing agencies of nursing popping up across the country. They're paying double, triple the salaries. Nurses are not working in their communities anymore because they're too tired of the awful working condition within our long-term care and our acute care sector. So they just go to an agency. And I mentioned that in my intro comments. I commit myself to an employer, and they cannot work with me to improve my working condition, and then my coworkers just leave for an agency. That is just opening the door for more privatization of our acute care sector. And that's where we're talking about our critical care nurses, where the specialization is extreme. Our emergency nurses, again, specialization is extreme. And honestly, paid by us, the taxpayers, and now they're going to agencies. So I'll keep it to that. We have many, many studies on the negative effect of privatization in healthcare, such as in education, that we need to keep those 5 principles of the Canada Health Act solid, and it's the role of the federal government to protect them.
Mr. Bolduc?
Oui, merci.
Yes, thank you. First of all, health is a public service. I have a hard time with the fact that measures are applied, austerity measures, budgets are reduced and all that, and then when a crisis comes up, we had the example with the health crisis, a crisis comes along, and then the system has undergone hard times for a number of years, and a crisis comes and is not able to respond adequately to the crisis. What do? They turn to the private sector, and then they say, look, it works with the private sector works, but it's not true. In Quebec, we turn toward placement agencies to bring in staff. It doesn't provide a public service. The regrets a brief technical interruption. It costs 2 or 3 times as much, and each time we get into a vicious circle, which causes the private sector to appear as the savior, but that's not the reality. The reality is that the public healthcare sector is neglected, and then they turn to the private sector and they say, look, it works. So then more is given to the private sector, and then the public sector is weakened even more. So that vicious circle must be halted. We need to focus our efforts on the public health system and give it the means it needs to do the work that has to be done and to provide the service to the population, to the community. And for my part, it's clear that the health service, just like education, is something that has to be provided from the viewpoint of a public service rather than with the view of earning profits.
I'm going to proceed until I'm told we don't have time. I just want to remind people again of Pat Armstrong's words that the condition of work become the conditions of care. And a reminder that compared to the OECD average over the last couple of years, Canadians had fewer care workers per 100 residents. Right there, when you cut corners and when you put profits before people and you put your shareholders' money before the care that you provide to our senior residents, the outcomes are going to be exactly what we saw. We performed worse put the respect and the dignity back into care. That starts with caring for the people, the patients, residents, and clients, but also care for the people who we rely on to care for our loved ones. So the conditions of care have to improve through the conditions of work improving and the wages improving.
Thank you, Ms. Stewart, and thank you, Madame Zarillo. Your time is up. Now we go to Madame Gladue for 5 minutes. You have the
Thank
floor.
you, Chair, and thank you to our witnesses for being here today. I'm going to start off, when I was on Health Committee, we actually did a study on long-term care and some of the factors affecting, and nursing and PSWs was part of that. And I believe Ms. Silas actually gave testimony there. And with respect to the 50% turnover of nurses, it was true then as well. And I just want to see whether the factors that were contributing to that are the same. So, Ms. Silas, at the time, it was violence in the workplace for nurses and PSWs, working conditions like mandatory overtime, and non-competitive compensations that was driving a brain drain to the U.S. Is that still the scenario with respect to the nurses?
Thank you, Ms. Gladue. I hope your daughter's doing well in nursing. right now it's the understaffing. 83% of our members are telling us they're working understaffed every day. That means every day they go into work, they're not able to provide great care. They're not able to do their job properly. That is the number one, followed by violence, and respect would be the third one, which I would put in the competitive salary.
It's really unfortunate then that we fired so many nurses for being unvaccinated and PSWs as well. I mean, that certainly made a bad situation even worse. Now, in terms of recognizing credentials across provinces, is there adequate recognition of credentials for nurses? And are we graduating enough nurses and to really fit the demand?
I'll start with your last question on graduating enough nurses. We honestly don't know. And that's why we're asking the federal government to do similar to what they did with the building trade, do a bill force, do an agency to see how many RNs do we need, how many personal care workers, how many doctors, respiratory technician, the numbers goes on. Right now, we know we have a shortage, and every vacant position in a province means they're going to stay vacant for at least 90 days. And that means 90 days of extra overtime, and that increased the burnouts. In regards to the vaccination, which was your first comments, I wouldn't worry that much. Not many got fired. Many got put on leave of absence, but the number is very, very slim. We're talking about similar to the population of Canada, around 8%, and that's about it. So our unions are working with the employers to provide alternate working arrangements, and some are still on leave of absence, but that's a public health crisis and a public health decision.
Very good. Mr. Bolduc, vous avez parlé
Mr. Bolduc, you talked about the need for workers, for nurses, the requirement for nurses, and is there a solution through immigration that could assist in that? Well, I believe the question was addressed to me. I didn't hear very well, but I think that was it. So, as a matter of fact, yes, immigration is one of the possible solutions. It's not the only solution or the big solution to improve things. However, first of all, in the entire immigration process, I would say that we need to speed up the process of processing of applications for permanent residence. We hear that all the time. The timelines are very long, the delays are long. But in order to improve specifically in terms of the healthcare sector, and this applies also to most professions, we need to facilitate things, and I think that we need to facilitate recognition of qualifications of candidates through immigration who wish to come and settle here, and also the conditions in which the workers, foreign workers, are recruited and need to be improved, the way they're treated in our country. We have, for the labor shortage, in certain specific sectors, there is a huge demand for temporary foreign workers, and those workers are often connected with only one employer. So we're asking to enable those people to get work permits that are open-ended, that enable them to change from one employer to another if the working conditions are not sufficient. It could happen that a worker might be in a work environment and that it's not going so well for various reasons. And currently in the system, thank you very much, sir. I think that is the end of my allotted time. Thank you.
And thank you, Mr. Bolduc. We'll now go to Mr. Collins for 5 minutes to conclude the first round.
Thanks, Mr.
first
Chairman.
session.
And my questions, first and foremost, are for Ms. Salas, and they're related to the whole issue of recruitment. So you were very clear in your opening statement where you identified both recruitment issues and retention, and I think many of the questions posed to you to date have, or this morning have revolved around the retention issue. But I want to speak to recruitment because I know our government's made some substantial investments in that area. And I was hoping to get your understanding in terms of what we can do to encourage more people to enter the profession. And so, Ms. Salas, the Foreign Credential Recognition Program currently is active in many provinces and territories. And I think it's to everyone's benefit that we integrate internationally trained immigrants into the workforce. There are literally thousands of foreign-trained doctors and nurses that are waiting to provide their expertise and their training and for it to be recognized here in Canada. And so I was wondering about that program. I know that the minister recently made another very large announcement, $26 million for 11 programs related to the same. And so do you see the Foreign Credential Recognition Program currently working, and is there more that we can do in that area to bolster the numbers on the recruitment side of the labor shortage issue?
Well, first, we need to turn the dial on their working conditions and the stories that are coming out. That's the number one reason they're not staying. We've seen federal government programs, provincial government programs to educate more in personal care workers. The last statistics I heard, only 30% of them stayed after they entered. So it goes back to what Ms. Stewart was saying, the condition of work. The condition of work will be the condition of care, will be the condition of retention. That's why I stress so much, sir, retention recruitment. If we don't change the retention aspect, we will never be able to recruit. In regards to the internationally educated health professionals, you see doctors, nurses, respiratory technician. Again, the list is long of those that need credentials, needs their license to practice. We need to standardize that. And the way to standardize that, Monsieur Bolduc talked a bit about it. We need to make sure that before they enter the country, they know what will be expected, and we help them. I was very pleased last Friday to hear my home province in New Brunswick looking at Earn to Learn programs, and it's at its newest beginning. But how can we integrate internationally educated healthcare workers into a program that they will be able to pay the bills and get their credential and get a permanent job in our system, and a permanent job where they will stay? So a lot of work, but I think it can be done.
Thank you for that. Subsequent question again to you, Ms. Salas, if you could. On the whole issue of, I've always felt it very important that all levels of government provide as much support to students as possible in order to help them complete their studies. And I know that the government has invested tens of millions of dollars for thousands of students who are currently enrolled in a study here in Canada. And I know that those investments are made to ensure that, it gives them a better chance to complete their studies. So on the whole issue of investing in our students, we have the programs. Could you comment on those that are in place and what you think we could do more of, or where we could place more weighted investments in students in provinces across the country?
Thank you. I think when you're in a crisis, paid education program, paid preceptor programs are very important. And those programs that do exist, there are pockets here and there. There are pockets that exist if an employer has applied for it, or a sector has applied for it. They're not generalized. I think your committee needs to look at what the federal government can do, similar to the EI programs. I always bring up to the committee, and we've been bringing this up to the Health Committee and the Human Resource Committee for over 20 years now. When you're a plumber in this country, you can apply with your employer to get a higher level of credential in your domain and paid by EI. When you're a healthcare professional or a healthcare worker, you cannot do that. We need to look at those different rules to be able to bridge our population, bridge our workers a step up. I know a lot of personal care workers that want to become licensed practical nurses. Why can't they do it while they're working? Licensed practical nurses that want to become registered nurses. Why can't they do it while they're working? And we looked at those programs early 2000. It's time we look at them again and we implement them and fund them this time.
Thank you, Madame Salas and Mr. Collins. That concludes the first round of witnesses. I, on behalf of the committee, want to thank Madame Salas, Monsieur Bolduc, and Madame Stewart for presenting to the committee this morning with your expert opinions. Thank you so much. We will now suspend for a couple of minutes while we transition to the second group. Thank you. Merci beaucoup. We'll suspend. I would like to make a few comments for the benefit of the witnesses. You may speak in the language of your choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either floor English or French. Before speaking, please wait until I recognize you by name. If you are on the video conference, please click on the microphone icon to unmute yourself. When speaking, please speak slowly and clearly. When you are not speaking, your mic should be on mute. I would like to welcome the following witnesses to begin our discussion. And each of you will have 5 minutes in your opening remarks, and I will ask the witnesses to honor the 5 minutes, because I will cut you off at 5 minutes for the benefit of the committee members. So we have Jody Hall, Chief Executive Officer, Canadian Association of Long-Term Care. We have Christina Bezans, Chief Executive Officer, Community and Home Assistance to Seniors, known as CHATS. And Ian Del Silvia, Director of Operations, Canadian Support Workers Association. We will start with the Canadian Association for Long-Term Care for 5 minutes. Following the opening remarks of the witness, we'll open the floor to committee members for questioning. Ms. You have the floor for 5 minutes.
Thank you. Members of the committee, thank you for inviting me to appear before you today to discuss Canada's long-term care sector and the challenges with labor shortages and the opportunities for urgent action. My name is Jody Hall. I am the CEO of the Canadian Association for Long-Term Care, also known as CALTEC. CALTEC is committed to advocating for quality long-term care for all, and we support the sharing of knowledge, insights, and best practices to ensure that seniors can live and age with dignity. I want to thank the frontline staff and long-term care leaders who have continued to provide care to long-term care residents throughout the pandemic. This has been a very difficult and painful experience for everyone in long-term care, and I want to acknowledge their dedication to the committee today. To begin, I'll provide an overview of current facts regarding the long-term care workforce and outline areas where we see opportunities. The most current data from StatsCan indicates that in the third quarter of 2021, there were over 30,000 vacant nursing jobs in nursing and residential care homes across Canada. To give a provincial picture of this, there are 3,400 vacant positions in care homes in British Columbia, which has nearly tripled in the last 5 years. We know that as our population continues to age, this not only brings expectations for increasing demand for long-term care beds, but also an expectation that the long-term care workforce itself will face an unprecedented number of retirements over the next decade. For example, in Ontario, 25% of the 50,000 PSWs that work in long-term care are in their mid-50s. On average, over 90% of the long-term care workforce in Canada is female. In Nova Scotia, over the last 10 years, there's been a 38% decrease in the number of certified care assistants, also known as PSWs, in other provinces. Among OECD countries, it can be projected that the number of employees in the sector will need to increase by 13.5 million by 2040. This is an important consideration for Canada in how we will attract skilled immigrants in the context of global competition. There are many examples of long-term care homes across the country who have closed beds as they do not have the staff to operate them. Currently in Nova Scotia, 19% of the homes in the province have closed admissions due to the lack of staffing. With the few examples that I've offered from across the country and the many reports from CALTEC members, it is clear that we are at a crisis point in long-term care staffing, which is raising questions on how will we sustain long-term care in Canada. Staffing shortages in long-term care are not new to the sector and has been a long-standing priority. Over the last few years, the situation has intensified, and it has been difficult to tell the story of long-term care and our workforce as the data that is available is limited, difficult to compare provincially, and there is no central collection to create a national picture. We are seeing investments being made by both provincial and federal governments to support recruitment efforts, and there are examples of innovation such as the Work and Learn program in Nova Scotia and the tuition coverage for personal support worker training courses in many provinces. But there's concern that as provincial efforts increase, competition will also increase and ultimately not result in an increase nationally. we would suggest that there's an important role that the federal government can play in bringing provinces and the long-term care sector together to create a coordinated Team Canada approach. The creation of a pan-Canadian health human resources strategy that allows multiple stakeholders to work together in a coordinated way would be a significant step forward. Despite these challenges, there are opportunities to better understand and make targeted investments. So improving data so we understand our challenges and how to address them. Domestic workforce development needs to address barriers to HHR education or health human resources education and promote long-term care careers. Supporting the current workforce to improve retention with targeted funding for mental health supports and addressing workload through increases in hours of care. And immigration, we know there are thousands of qualified healthcare professionals who'd be willing to come to Canada should avenues be available to them. And providing better support to those who contribute to the care economy in long-term care homes, such as family and community volunteers. I'd be happy to speak further to these specific examples, but in closing, we strongly urge the federal government to consider the opportunities that we have noted and to act with urgency in recognition of the emergency situation that we are facing once again in long-term care. So thank you for your time, and I'll be pleased to address any questions.
Thank you, Madame Hall. Now to Madame Bezant for 5 minutes.
Thank you very much, Mr. Chairman and honored members of the committee. I'm Christina Bizanz. I'm the CEO of CHATS, Community and Home Assistance to Seniors, and I want to thank you for the invitation to be here, and especially to thank MP Van Bynen for his encouragement to request this opportunity to speak with you today. Your study of labor shortages, working conditions, and the care economy couldn't be more timely, and we sincerely thank you for making this matter a priority. CHATS supports approximately 8,500 seniors and their caregivers across York Region and South Simcoe by providing a full continuum of home care and community services. Our mandate is to advocate for and deliver high-quality home and community supports to enable our clients the dignity and choice for aging at home. We believe that older adults live best at home and in their communities. There's an abundance of evidence to demonstrate that this goal is entirely possible with the right supports in place. Keeping people at home significantly alleviates pressure on hospitals and long-term care, but our ability to recruit and retain the necessary frontline workers is severely threatened, and we're facing a crisis in care that has only been made worse by the pandemic and the public policy response to it. The staffing crisis in home and community care is not new news. For years, our sector has been sounding the alarm with the low labor supply of personal support workers and other staff. We're seeing increased retirement workforce that is not being replaced through new enrollments in PSW programs. Half of new graduates leave the sector entirely due to working conditions and low pay. The lack of guaranteed hours, part-time, shift and weekend work makes it challenging to earn a decent income. A vehicle is required to drive long distances to serve multiple clients, especially in rural areas, and mileage reimbursement has not kept pace with fuel costs, especially now. Frontline staff in home and community care are the lowest paid in the entire healthcare system. Recently, the Ontario Community Support Association, which represents CHATS and over 200 other nonprofit organizations, conducted a member survey which showed that staff vacancy rates for 2021 nearly tripled. PSWs and nurses are leaving the community sector in droves, many to other sectors where there are incentivized opportunities to shore up their income. It makes little sense that workers in a sector that has shown its incredible ability to support people to stay in their own homes are barely considered in health human resource planning or funding. Public policy decision-making continues to disregard and overlook the value, efficiency, and effectiveness that home and community support services delivers to the health system and to the quality of life for the person served. For example, the Ontario government recently announced additional hands-on training opportunities and further incentives for more PSWs and nurses in the long-term care sector. We all agree that our healthcare sector system is in dire need of many more well-trained staff to help address the tremendous resource challenges. But by announcing these incentives for PSW nursing and long-term care only, the provincial government is amplifying the very staffing issues that is eroding the healthcare safety net of home and community services. What does that say about the value we attach to those frontline heroes who enable people to live in their own homes rather than more costly long-term care institutions and hospitals? In Ontario, billions of dollars are being pumped into building more and more long-term care beds, with little investment being considered to reducing the need for some of those beds in the first place. By ignoring the impact of such decisions on equitable workforce resource allocation, the home and community sector is hit dramatically on the recruitment front, placing greater demand on burnt out healthcare workers, overwhelming family caregivers, exacerbating wait lists for services in the community, increasing risks and costs to the most vulnerable in our society. This committee can demonstrate the leadership we need for a comprehensive health human resource strategy that builds capacity across all sectors so we can meet the growing demand for services that keep people living well at home and in their communities. But getting there will require collaboration between the sectors and all levels of government. Continuum rather than looking at our health human resources in silos. I thank you and look forward to your questions.
Thank you, Madame Bezants. Now, Mr. Da Silva for 5 minutes.
Thank you. I'm Ian Da Silva. I'm the Director of Operations for the Canadian Support Workers Association. We represent 50,000 plus 60,000 PSWs right across Canada. Governments, and I would like to thank you for having us here today. Government's health human resource strategists, labor leaders, and advocacy groups have long held true that the simple reason that there are significant staff shortages is low wages. The impact of the COVID-19 pandemic and the current staffing crisis must force us to reconsider our decades-long fixation on wages as the principal driver behind any healthcare shortages and challenges, as this is simply false, and the reason why we are all here today. The reason is simple. It is the absence of basic professional respect and, most importantly, dignity. PSWs and frontline healthcare workers deserve a guarantee that their title of personal support worker or other provincial title simply be stolen from them at any given time. In short, title protection provides the professional dignity arises. Unfortunately, for many Canadians, frontline healthcare workers, this is simply not the case, and sadly, their dedicated time in these roles is increasingly perceived as having been a bad investment, especially as governments and employers refer to them with several different titles. In other words, why hire a PSW when one can hire someone else, calling them something else, to do the job of a PSW for less money? PSWs across Canada serve as the backbone of the entire Canadian healthcare system. Personal support workers spend more time with patients, and the shortage in our numbers is felt many times over from senior members of the healthcare team. Consequently, Canada's healthcare workforce is completely exhausted, creating a vicious domino effect that our healthcare system may not survive. To reverse this exodus and ultimately stop this cycle, we ask this committee what we have always asked for and what our members continue to demonstrate to Canada: respect. Ending this title flexibility will establish the necessary foundation to end the perceived replaceability of these workers. Human resource leaders across Canada remain incorrectly convinced that the solution can be solved by simply opening the floodgates to fill these vacancies. But what impact does this have on those who have already paid for their education? Who are these people? And most importantly, what about the patient? At the end of the day, it must be remembered that the PSW and the patient are cut from the same cloth. They are the guardians, protectors, and they are the real face of the Canadian healthcare system. Patients across Canada in both home and long-term care facilities need to become the focus of government policy in coming years. Governments and advocates regularly tout the need for patient-centered care. This is the concept that our healthcare system was originally built upon, but over time has become hijacked to focus on the needs of the system and its players, effectively making patients the last priority of government and industry planning. For the past decade, the Canadian Support Workers Association has fielded concerns from families and caregivers expressing dismay at the turnover rates in all settings. The exhaustion having to explain a health condition in detail, often several times within a 24-hour period, to new PSW or other workers with another title, and less training becomes an overwhelming experience on its own. This situation is often worse for the sizable population of those with dementia whose needs for continuity of care are becoming unachievable. Patients are further disadvantaged by the significant disconnect in policy planning in that decision makers remain very far removed from frontline healthcare activities. The disconnect serves only to fuel feelings of dissatisfaction from PSWs and those performing the duties of a PSW. Pursuant to Standing Order 1082, the Canadian Support Workers Association and its provincial chapters formally recommend the Minister of Health support the ending of unregulated healthcare provision in Canada and the recognition of the title of personal support worker. This would be an important first step in ending the constant devaluation of the PSW education and encouraging future Canadians to enter this field. Most importantly, a professional framework will provide a permanent mechanism to conduit the concerns of patients to the health system, and most importantly, vice versa. We ask this government to help us make the patient the priority again by making the PSW a profession of choice for Canadians. Thank you. I'm happy to answer any questions. Thank you.
Thank you, Mr. De Silva. Now, for questioning, we go to Madame Kuzi for 6 minutes.
Thank you very much, Mr. Chair. And I'd just like to start by welcoming Marilyn Gladu to the committee. Marilyn, it's a pleasure to have you here. I know your years of experience certainly will benefit the committee, so we're very happy to have you here. Secondly, I'd like to thank all of the witnesses here today, not only for appearing here before the committee, but just for your dedication to not only what has been a challenging last couple of years, but also for your commitment to those who are the most vulnerable, who need care. And I, along with the members of the committee, I know are just truly grateful for the dedication and sacrifices you and your members make for so many Canadians and to their families. So thank you very much for that. Certainly, as we begin this study, as a previous witness mentioned, we are still emerging from the pandemic environment. One of my colleagues on the committee talked about the media stories which appeared at the commencement of the pandemic and the critical stress that put on long-term care facilities and long-term care workers. So my first question is to Ms. Hall. Ms. Hall, I would like your opinion as to why we were so woefully unprepared for such a tragedy and such a tragedy that hit us. Thank you.
Thank you for the question. I think there's several factors that feed into that. There's been chronic, long-standing underfunding of long-term care across the country, I'd say at all levels. And so that certainly created a circumstance where we see an overall weakness, but certainly at the very beginning of the pandemic, homes had very limited access initially to PPE. That was a key challenge at the start. There was also a delay in receiving specific guidance from the Public Health Agency of Canada for long-term care home operations with the pandemic. So that was also a consideration. There was a lot of tremendous amount of information that was moving from multiple sources. And so, having timely scientific-based evidence-based information was critical. There's also more of the bigger picture questions about the age of the infrastructure that we have of long-term care homes across the country. There are many examples of, infrastructure that was built decades ago. They were designed for a different generation and a different time, and trying to implement modern infection control and prevention practices became an incredible challenge for some, right down from the size of hallways, shared dining spaces, and even ventilation systems. So there were a number of critical factors that played into all of those circumstances. Certainly the vaccine has been a tremendous advantage and game changer for many across the country, although homes are still, examples of them experiencing outbreaks. The severity is certainly less And we certainly appreciate the government's efforts in getting vaccines to long-term care residents as quickly as possible.
Thank you very much, Ms. Hall. Mr. De Silva, you talked extensively about the ideas of respect and dignity as being central to, well, obviously not just for humanity, but also in the matter of attracting and retaining support workers. So you mentioned both the importance of the title as well as the necessity of the framework. But I was hoping perhaps you could sort of provide more context as to what respect and dignity means to you and your organization, and how that can be tied to the attraction and retention of support workers.
Thank you. That is the primary element of what we're trying to do as the Canadian Support Workers Association, is to put essentially a fence around that title. Now, right now in Canada, there are a number of different titles that can describe the work of the duties that a PSW or community care aide or whatever perform across Canada. Within each province, however, the provinces can simply create new titles to redefine that role at their leisure. So right now we're dealing with essentially, it's a bit sounds like economics, but it's an opportunity cost question. Why would anyone, if you have an opportunity to become a PSW or enter healthcare or not, an investment of time and money, why would you make it into a field like healthcare for PSWs when that title is not guaranteed? And on your first day of work, your boss can say, well, I don't want to pay you that much money. I'm going to pay $1 an hour less to someone that I found in the parking lot, but I'm just going to give them an in-house training. That's happening again and again, and has been happening for a decade, constantly eroding the value that these people feel on a day-to-day basis. The senior members of their team and their directors of care can easily tell them, and tell them regularly, you don't have to be listened to because you can be replaced on a thought. This does not apply to nurses. This does not apply to doctors or any other profession except for frontline healthcare workers. It is impossible to attract people. That's why it's no longer worth the opportunity cost to go into healthcare versus not going into healthcare. Until we can actually put a fence around and guarantee any sort of investment around the title of the personal support worker in Canada, we can keep dumping money into this and it will continually filter away because it's a bottomless pit. And until you can get, like Ms. Silas and Ms. Stewart were saying, it's a question of what are the conditions of employment? Well, the conditions for a PSW are horrible. They're not allowed to have respect. Their unions may or may not speak for them because they have no professional association that they're mandated to join. And they can be terminated on a thought. So it's once you can end that process and embed that title and create a baseline, that's what we need in this province, in this country, for our patients, for everybody. And we don't have that right now.
De Silva, and thank you, Madame Kuzi. Now, Mr. Long, for 6 minutes.
Thank you, Chair, and good afternoon to my colleagues, and good afternoon to our witnesses. And my questions will be for Ms. Hall. Ms. Hall, thank you so much for the work you've done, certainly in our home province of New Brunswick, on behalf of seniors. It's very much noted and appreciated. And I think it's important, actually, before I ask you some questions, just for us, or for me, to just briefly talk about what our government's done on behalf of seniors. And certainly, going door to door in the past 3 elections now, we hear from seniors, we hear the needs from seniors. And, I think our government has stepped up, whether it's the, increase of 10% for the GIS that, financially helped almost 900,000 seniors. We certainly enhanced the New Horizons for Seniors program, offering a lot of, different programs to different nonprofits, if you will, around New Brunswick and certainly across Canada. Moving forward, we've now are going to increase the OAS by 10% for seniors that are over 74 years of age. We did issue the one-time payment of $500 in August to OAS pensioners. We rolled back the age of eligibility from 67 to 65. And we're certainly committed as the government to increase the GIS by $500 for single seniors and $750 for couples. And last but not least, one that certainly very meaningful to me and my mom was increase the exemption. That allows seniors to earn up to $5,000 without a reduction of benefits, and then a partial exemption for the next 10,000. Those things are very, very relevant to helping seniors. With respect to long-term care, Ms. Hall, and you touched on it in your answer to MP Kuzi, but I wanted to just for you. I mean, look, we all recognize as a federal government, jurisdiction's a major issue when it comes to federal government's involvement in healthcare matters. I know you hear that often. In your opinion, how do you think the federal government can help provinces and territories with infection prevention in long-term care facilities and the staffing shortages in the labor market? Thank you.
Yeah, thank you, MP Long, for your comments and for your question. I think that there are a number of examples, as you've outlined, where this particular government has made investments for seniors. I know you're continuing to do work to better define abuse, and that has some very important legal implications, and as well, the funding that was offered for long-term care homes through the Safe Long-Term Care Fund was absolutely needed and appreciated through the last few years of the pandemic. Specifically for how the federal and provincial governments work together, I think it's imperative that this jurisdictional question not become a barrier that stops action, but becomes one that opens engagement. And, you know, when I talk about a pan-Canadian health human resources strategy, you know, and we see the work that the provinces are doing to recruit, it's critically important work. But, you know, it kind of becomes too many chefs in the kitchen when we're all bumping into each other and perhaps unintentionally recruiting care providers and health human resource experts from various provinces, as opposed to helping to really help to develop the workforce. I think there's a great opportunity to really develop the domestic workforce capacity that we have. I think there are many opportunities, whether it's marketing of the profession and working on that together, specifically working to recruit men to the profession. I've noted that 90% of our workforce are women, and there are some really interesting examples that was launched by the government in the UK as an example about recruiting men into care that did have great success. So, you know, as we look to the example of how the Safe Long-Term Care Fund was structured, and perhaps even looking to the example of how childcare funding is being offered across the country, I think there absolutely are ways that the federal and provincial government can collaborate to, you know, address some of these key challenges. And of course, the long-term care sector would be very pleased to be part of those discussions and support as well.
Thanks for that answer. I do want to drill down a bit just on staffing shortages. I mean, we certainly saw through COVID the desperate long-term facilities found themselves in. You know, it was deplorable. And, you know, we've all heard about the role the staffing shortages played in the tragedy, but can you just explain to us the direct impact understaffing has on seniors in these homes?
Yeah, I think that a key element, as we've had long-standing issues with staffing shortages across the country. That's not new, but it became exacerbated during the pandemic, where we saw examples. One of the strategies used in provinces where staff could not be shared across different employers. And that is something that did impact on the workforce numbers, and of course, the emotional impact that was that took its toll on some individuals through the pandemic outbreaks. I think resulted in those who had to leave, and of course those who were assigned to work from home because of exposure concerns. So, you know, when we think about the impact on the residents, you know, there were other services, a lot of the elements that we might add for activities that enhance quality of life, and that we do use volunteers to support in many ways, and they were not able to enter the home. designated support person or essential caregiver role was very important in kind of shoring up those efforts. So, the impact of social isolation was one that we were all gravely concerned about, and did use technology as a way to connect residents with families to the best of our ability. But it was an incredibly challenging situation, and there certainly were outstanding implications.
You mentioned
your
presentation.
Mr. Long, your time has gone by.
Ms. Hall, thank you very much.
Thank you.
Thanks for what you
Ms.
do.
Hall.
Thank you.
Madame Chabot, pour 6 minutes.
For 6 minutes. Thank you. Thank you very much to the witnesses, Ms. Hall. If you have 30 seconds, I would like you to talk to us a bit about yourselves and the role of your association with regard to long-term care. But my question will deal with 2 of your recommendations, the first being on immigration. You stated in your recommendations that thousands of healthcare professionals who are qualified would be ready to come to Canada if they were offered the opportunity. Can you tell us more about that, please?
Thank you for the question. The Canadian Association for Long-Term Care is an organization that began as almost a networking group in 2002. And since that time, we have grown and evolved to become an organization that represents a range of long-term care homes across the country. We have a mixed membership base of many different types of long-term models, and we're pleased to be able to share best practices, create knowledge translation, and really do extensive support and engagement amongst those audiences. And of course, advocacy with the federal government is a key focus for the Canadian Association for Long-Term Care. Sorry, could you repeat the second half of your question again, please?
Would you be good enough to tell us more about your recommendation that has to do with immigration, please?
Yep, sorry, thank you very much. So one of the things that we've noted, and we have certainly met with the Minister of Immigration and with his team, we've looked at the EMPP program, Employment Mobilities Pathways project that targets with skilled refugees to be able to come to Canada. We do believe that there is a tremendous opportunity for expansion under that program to connect these skilled refugees with long-term care employers. We've had conversations with Talent Beyond Boundaries and Refugee Point, and both of these humanitarian organizations do this assessment to identify these individuals who could and are interested to come to Canada. So that's one example where we feel that there is a great opportunity. I believe it's already been noted for the committee today, however, that there is more work to be done when it comes to recognizing the credentials of internationally educated nurses. We would very much like to see and recommend that those who are responsible to license and regulate the various levels of healthcare providers. We certainly understand the diligence that's taken to ensure that they are safe practitioners, but if that could be kind of reconsidered as to how do we ensure that the processes in Canada are as efficient and along the same timelines as the processes for other countries? Because I had noted that this is a global competition. It's not just Canada that's trying to recruit these individuals, and it's critical that we look at this from this lens.
Merci.
Thank you. And once again, Ms. Hall, you spoke about a recommendation of providing better support, particularly to families and volunteers in the community. And also, there's the whole aspect of natural caregivers, that, depending on what term you use for them. What have you observed? Would there be some way to strengthen the role of those natural caregivers?
Yeah, I mean, the role of volunteers and the essential caregivers or natural caregivers it's so important. We've come to see them as a key partner for us in long-term care homes. I'll use an example from my own home province where the long-term care homes in that province receive 30,000 hours a month of volunteer time. That was documented just prior to the pandemic. So the significance of their contributions to support the quality of life for residents is very, very noteworthy. I would suggest that equipping the employer to strengthen their engagement with the volunteers and with essential caregivers is very important. A lot of the resources are sort of left to the homes to find, to offer them specific training and opportunities for engagement and community-based activities that really create a strong link for the residents and their local community. So looking at funding for activities that strengthen and educate these audiences is critical.
Thank you, Madame Chabot. Now to Madame Zerillo for 6 minutes.
Thank you, Mr. Chair. And I'm going to just ask some questions around data and data collection, but I wanted to start by saying thank you so much to the witnesses and gratitude to your members and also the workers. I heard today respect and dignity over and over again, and I just wanted to share some respect and dignity to the workers and members. I'm going to ask Madame Hall, then Mr. De Silva, and then Madame Bizans. On the respect and dignity, traditional women's work, paid and unpaid, has long been undervalued and devalued and moving to exploitation. And I just appreciate the fact that the witness testimony today will help change that. Going back to the data and around retention specifically, what kind of data should the federal government collect to highlight the reality of working conditions and gaps in compensation for PSWs and long-term care workers?
Thank you for the question. I think the absence of data in long-term care, it's been an area of key advocacy for the Caltech for some time, not only about resident clinical data. There are tools to collect that, and today there are about 32% of long-term care homes who do not have access to those tools. But when it comes to workforce data, that is where there really are no consistent tools that are available for that. And we can see in the draft national standards that have been brought forward that this is a key area of focus, but it puts the obligation on the employer to collect the data with tools that we don't have today. So there'd be a significant investment that would be required. One thing that we have noted is that there could be an opportunity through Statistics Canada to expand the current labor workforce survey that they do now, but in a way that it would more specifically target the long-term care sector and bring the data to an aggregate level. Or a disaggregate level, pardon me, so that it could be very specific. Right now, even if data was collected at the home level regarding the workforce, there is no body to report the data to create sort of a national analysis. So making sure that we have tools to collect the data, but also that we have a way to analyze and use it once it's done is essential next steps.
Thank you. And Mr. De Silva.
Thank you. Data is a huge problem for frontline healthcare. As we said, there is no title protection, so there's no corresponding professional knowledge in which to accumulate or to store that data. It's very much a complete this about a year ago, the Canadian Support Workers Association actually took it upon itself to invest money in developing a national competency and data measurement assessment tool, which works already, designed to first to determine interprovincial competencies between provinces to allow for PSWs to move between provinces easier. For example, PSWs can come to Ontario and work. No problem with the Ontario PSW Association. They just can't go out and work in other provinces. So we want to end that. So we've developed a tool already, and we're happy to share it with government, of course. The money's already been spent, so the tool exists. That tool will not only measure competencies, but it will be an initial step to actually beginning to gather some of these data points that we simply do not have access to. But it will require from this committee some endorsement of the idea that we need title protection so that we can at least start creating the mechanisms, like Ms. Hall is saying, to create those mechanisms to collect the information. And since this meeting has begun, the number of terms we've used to define the personal support worker, just bear that in mind. We've called them community care assistants, personal care aides, community care aides. It goes on and on. So we really need to settle on one title nationally, allow the provinces to start housing that data provincially, but then also using this interprovincial competency tool to conduit that data to a national level. And it's all there. It's ready to go. We're ready to use it. I hope that answers it. We also grandfather in nurses as well into Ontario to work as PSWs, and we've been doing that since 2019. So we have mechanisms in place to move IENs into this province, no problem, in Ontario at least.
Thank you. And Madame Bizans, I think we have just under a minute.
Oh, okay. So I just have to echo the challenges around ensuring that in data collection, we're very clear on how we define the roles, because there is a lot of intermingling of how we use terms such as personal support workers, home support workers, community support workers, and to enable us to really reflect what the numbers are, the statistics, it would have to be clearly defined. We've had situations, for example, in the past where the province of Ontario has offered increased wages in short amounts, but will cover PSW certain functions, but not PSWs who do other functions. And so, if we're going to collect meaningful data, and I fully support the need for that, because I think that in our own workforce planning, we need to be aware of what the data tells us. But I think it's important to underscore that we define the roles as opposed to define the titles in collecting that data.
Ms. Bizans and Madame Zarillo, your time is concluded. We'll now go to Mr. Ruff for 5 minutes.
Thanks, Chair. So I got a few questions, but my first questions will be to Mr. De Silva and to Ms. Hall, and it's really around the challenges with PSWs in part-time versus full-time work. And I'm just interested in both their feedback on how we can solve this challenge, recognizing that, this does delve into some provincial jurisdiction as well, but there's so many PSWs having to take jobs in multiple long-term care homes in order to make do, and what are some solutions to resolve this?
Ms. Hall, would you mind if I go first, or do you want to? Okay, thank you. Essentially, the that the dignity element is the key, and that dignity element is tied to that professional title. Now, the reason we have seen a lot of these jobs go from full-time to part-time, and it is a member issue on a large scale for us right across Canada, is simply because employers have that flexibility to hire other titles to replace that personal support worker, and they can do so at leisure. And because there's no regulatory or title protection around that, it's making the job of trying to secure first full-time PSW work extremely hard, because once you start establishing, okay, we want to hire a PSW full-time, what is a PSW? Who defines that? There's no college, there's no anything. So other than the Canadian Support Workers Association. First role is you need to standardize the title. Then you're going to see some ability to, and that goes right across home care and long-term care, standardizing that title. It's this personal care is personal care right across the board. And then you'll start seeing that those part-time jobs, in theory, that they should start going away. But right now, there's no incentive to hire full-time, none.
Ms. Hall?
Yes, thank you. So what I would add is, long-term care homes are 24/7 operations. And so within that model, there is a certain amount of staff that are always required to be on a part-time or on-call basis. That is essential to the model. What I will note is that as far as the amount of hours that are available to create full-time and part-time positions, that comes back to the hours of care. So the hours of care in a home really is what drives how much time a care provider is at the bedside of a resident. And that those hours then translate back into the number of positions that you can create. And with a 24/7 operation, the employer decides what they need for full-time and part-time to keep the home running. So, that's all part of that piece. And so we do see provincial governments that are now taking steps to increase the hours of care and are establishing targets for that. Of course, it then comes back to what we're talking about here today is the staffing shortages. So we can increase hours of care and we can make those resources available, but at the same time, we need to be extremely diligent in continuing our efforts with urgency to increase the actual pool of people that are available to work in our homes and into all of long-term care.
Thanks, Ms. Hall. My final question will go to Ms. Bazans, and it's more about rural Canada and even the Arctic to some extent, because there's a lack of long-term care homes, obviously in the north. But specifically, what can the federal government do to support rural long-term care access, aging at home? In particular, one of the challenges that I'm hearing from PSWs in my riding of Bruce Grey Owen Sound, which is the second oldest demographic in Ontario, but there's no workers. And part of the reason, even if they can get work, there's no place for housing. If you're going to stay at home, there's no internet access, et cetera. So can you just expand a little bit on that, Ms. Bazans, on the importance of housing, internet access, and how this all ties together for rural Canada and even the Arctic?
Well, thank you very much. And I think, that's a great question. And first and foremost, I think that what we really need to do services are part of the continuum of care and must be reflected in our national health policy and delivery of health care. I think the federal government should. Canadians have overwhelmingly told us that their desire is to age in place, as you've indicated, and funding and policies need to mirror those wishes. It's time that the federal government commit to including community services in the Canada Health Act. Right now, the only guaranteed health services Canadians get is in hospital. And as long as we have that paradigm in place, we'll continue to undervalue home care supports and community services. And require just chats to operate on shoestrings and expect that our workers are able to drive from client to client and not be fully compensated for the time that takes, or to be fully compensated for the cost of gas to get from client to client. We have many examples of supports that are actually provided 24/7. Our assisted living program provides support to seniors who live in areas where personal support workers are co-located in buildings, but in cases where clients are living in the rural community, the PSWs will go out and do visits to them on both an unscheduled as well as scheduled visit. There's a lot of things services that are being provided that are unrecognized, undervalued, and if we continue to do that, the resources necessary to serve those rural communities, the clients in those rural communities and northern communities is going to continue to be underserved. And the housing. Sorry.
Okay, you may be able to finish that with the final. To Mr. Van Buyne for the final 5 minutes.
Thank you, Mr. Chair, and I do want to thank all of the witnesses for taking the time to give us the benefit of their perspective on delivering service at the grassroots level, and particularly, Christina, I know that you have a busy schedule, not only through chats, but also through being a counselor with the town of Newmarket, so I appreciate you taking the time to join us. So my question is for Ms. Bazance. I understand that one of the core aspects of the New Horizons Seniors Program is in promoting volunteerism among seniors. And do you feel that the federal government has any role to play in increasing organizational capacity of volunteer-based senior-serving community groups? And is there any tools that could help address the gaps, those gaps in the labor market?
Thank you, Mr. Weinbein, for first of all, I want to thank the federal government and the New Horizons program for having funded a number of initiatives that CHATS was able to deliver in increasing support to our clients, to seniors and their caregivers. I think that the value of those programs can't be understated, and I know that there was funding available through the pandemic to enable us, for example, to quickly switch from our in-person programming to offering virtual programming, internet connection, tablets, literacy training to keep seniors connected through the time of the pandemic. And we would not have had the resources had it not been for that special funding. Moving forward, I think that we do know that we rely on volunteer support for a lot of the services that we provide, and were it not for volunteers, we couldn't possibly be able to reach and serve as many seniors and their caregivers as we do. But it's not the only solution. Often this funding is provided as one time. We can set up a program, but we need to be able to continue to operate the program, especially once we've developed expectations amongst our clients that that program will be available to them. And so I think that the question of capacity needs to be built into the way in which the program funding is structured, with a recognition that the ongoing operating costs must be factored in as well. We know that while volunteers are a very important resource to us, the pandemic showed us that when we had to appreciate that our volunteers, many of whom are seniors themselves, had to shutter for a large period of time, that resource wasn't available to us anymore. But the expectation and the need for the services to continue was still there. So I think from a capacity standpoint, we appreciate the one-off funding, the one-time funding, but we also need to look at how we can sustain the resources and sustain the capacity to continue to offer those services.
Thank you. And I noticed in your earlier comments your concern about the propensity or the prioritization of institutional care for the elderly as opposed to aging at home. And I guess intuitively we know it's more cost efficient, we know it's more effective method of health care, it's a better quality of life. Is there any evidence or are there any studies that you could submit to this committee that could show the effectiveness of aging at home as compared to institutional care?
Yeah, I would have to look into the specific studies, but I think that there's a wealth of evidence that supports and not to undermine that there isn't a need for other forms of care depending on the complexity of the individual, their access to caregiver support that will help them to stay in their home, and of course their access to home and community services. Where they live has as the previous MP had indicated, has a huge bearing on access to services and ability to be able to remain in the home. But we do know, and the evidence does support that we can do better. If we look at jurisdictions outside of Canada, Denmark, for example, which demonstrates that home care support can keep people in their own homes much longer, and in fact has been well established and well proven. And I think we just need to to shift our paradigm and shift the way in which we culturally view aging in our society and the importance of recognizing quality of life, of choice and dignity of that choice for individuals where possible.
Thank you.
And Madame Zans, that concludes. Okay. I will get to it. I just want to clear it. With that, that concludes the witness list for the second round. I want to thank the witnesses, Madame Hall, Madame Bezans, and Mr. De Silva, for your very good testimony. And while you're leaving, I would just ask, I need direction from the committee on 2 items. So the witnesses, thank you for your contribution and testimony today. While we're doing that, Ms. Gladue referenced in her comments a previous committee report, and do you want to speak? She wants permission.
Yes, thank you, Chair. With the committee's approval, I was just going to suggest that the parliamentary analyst forward those reports to you for your consideration. It could inform the study. One was on unpaid work, and the other one was on working conditions in long-term care.
Thank you. I think they would find that very informative. That's something we'll be able to do. Thank you, Ms. Gladue. Ms. Cirillo, I do have one. I need direction from the committee on one committee business.
Yeah, I just had one request too. I know Mr. Van Bynen had asked last time that any reports that are referenced in witness testimony would come to the committee, but I just wanted to ask specifically around the construction. Today it was mentioned that construction trade has Canada-wide strategy. I'm wondering if that strategy could come to the committee as a template or as an idea. And I say that too because Ms. Nord from the Canadian Chamber of Commerce mentioned in our last testimony that she can tell us the age distribution of construction workforce, how many women, Indigenous people, and new Canadians work in trade, and she can break down those numbers by jurisdiction. So I'd love to see that as a framework for what could come to help.
Madame Cirillo. One direction from the committee is our next meeting on Thursday. The Minister Qualtrough will appear on 2 items, on the main estimates and on our mandate letter. The Minister has requested extending the permission to extend her opening comments from the normal timeline to up to maybe 10. Given that she's speaking on 2 issues, she's already also indicated to me, the chair, that she would extend her time for committee members to question her. So I need direction from the committee. Is it agreeable that she prepare for an opening statement of 10 minutes? Okay, I see a consensus. So with that, thank you, committee members. The committee meeting is adjourned. See you on Thursday. And my apologies, I forgot to officially welcome Madame Gladue to the committee. Thank you for your participation today. Okay. You didn't tell me if you were staying long or not. So.